physical therapy, people are like, well, I don't want to go to physical therapy because then I have to get a referral, which in Kentucky it's direct access. But like,
for not all insurance.
Sadly. But like, you know, I hear a lot of them, well, like, I've been having pain, or like, you know, I just want my kids to be able to return to sport and things like that. Yeah. And it's kind of like, there is a big rift between what I can do in my practice. Like, strength and conditioning is not diagnosis, and it is not like treatment in the sense that I'm going to get them to return to normal or anything like that. Mine is like, once they have medical clearance, I can continue on.
Right.
But, so you said physical therapy, you had your first experience.
Yeah, so I took my son to the physical therapy appointment, which was the first time I've seen the whole evaluation process. And I was fascinated by it. Probably the physical therapist probably thought I was like a kid in a candy shop. Because I was like, what? Right. I was
How's that go?
Right. I'm like, wait a minute. This is, everyone should know this. Yeah. So we don't live in a world where people have to go see their pediatrician and a physical therapist before they do activities. But he's kind of stuck, physical therapists are kind of stuck in a unique position because they are trying to fix a problem after it's already started.
Yeah.
Whereas if we could do more preventative, and he could, we talked about how, he loves to go to sports teams and teach them the right ways to stretch before and after. And, he's so focused on that prevention that I'm like, you're speaking my language right now.
This is fantastic. Yeah, this is like good stuff.
Yeah, to kind of uncover, like, everybody has different mobility. Everybody has different strengths. And so
metrics. Like, you can't tell someone who shouldn't be squatting with, like, this position.
Yes. But I've been
versus another person.
Active and competitive my whole life in sports, and my kids are. And I just recently realized the importance of how that is, how amazing physical therapy could be. So I think that if more of that was out there, we would encourage people to, be evaluated, get some ideas for exercise. Let's see how we can do this safely, especially if you're thinking about the competitive sports, But if there was more of a presence, more knowledge about the importance of that, I think that it would change the physical therapy world too, because instead of, again, trying to always recover from something, you would be...
Well, I think that's also too, because I had, and this was after my sporting career, but I had 2 wicked concussions within like a year of each other. And then I think about all my friends who played soccer and football, and like, no, in soccer, if you get a concussion, it's straight up direct contact. There's no helmet to like help you, sustain any support. It's just you're knocking heads with someone. And I had one friend who I think throughout her high school career get 5 concussions. Yeah. And it's just kind of like, if she maybe, I know that ATs and things like that, like, have that kind of concussion test and things like that. But if you have a baseline, if you have seen a PT, they might also have a kind of like longer term, like you said, family physician wise, they have that background. Yeah. They know you're not moving the way that you normally move. Right. Or for FMS, right? Because we had a lot of PTs do the FMS this past week. Right. Like, FMS is a great baseline for simple mobility work. So if you're not able to do something you were able to do a year ago, what's the difference?
Right. And I think right now, I'm sure the limiting factor has always been money in the past, right? Yeah. Insurance isn't going to cover a healthy person to just go to physical therapy just for fun. Yeah. But with the medical side, they're starting to get on board. Your well visits are typically covered 100%. Yeah. So they're starting to realize prevention. Yeah. So I would love to jump ahead 10, 20 years to see where we're at, because hopefully it will cross over into all the other specialties that are all related, and we finally figure out, wait a minute, if we fix this on the forefront, we're going to really save a lot of money in the end, because we're not fixing problems, we're preventing them. So I do think that's been a practical limiting factor for people, but so maybe that's why people aren't necessarily just coming to our office saying, hey, send everybody here. I know they're healthy, but really they should. In a perfect world, that's the way that it should be. So, thank you.
Yeah. Hey.
That's it for our next hour.
Yeah, but I mean, like, that's something that I have been trying to, like, ration through, too, because I feel as though, especially with social media, there's so